Lung cancer is the leading cause of cancer death among men and women globally. Only 15 to 30% of patients with limited stage small cell lung cancer, known as LS-SCLC, an aggressive form of lung cancer, will be alive 5 years after diagnosis. Additionally, disease reoccurrence can be an unfortunate reality. But a recent FDA-approved treatment for LS-SCLC is renewing hope for patients and the multidisciplinary treatment teams. Here to discuss the latest advances and why open communication between doctors is so important in cancer care is Dr. Martin Dietrich, medical oncologist. Good morning, Dr. Dietrich. How are you?
Good morning. Thank you so much for having me.
Thank you for letting me do the mouthful on this. I always have trouble talking sometimes. So, doctor, what can you tell us about a specific type of cancer that you like to focus on?
Yeah, our current excitement lies with small cell lung cancer, in particular, limited stage small cell lung cancer. And that's a disease entity that has given us a lot of grief. Small cell lung cancer being the most aggressive subtype of lung cancer. There are many types of lung cancer. This is the most aggressive one. And limited stage describes that it's disease confined to the chest and typically approachable by either surgery or radiation therapy, with sort of a confined, non-spread distribution of disease in the chest. An area of very high disease need. We have many options that are not available yet. So we're excited that there has been recent movement in therapeutic opportunities for patients.
How important is a multidisciplinary approach to this type of cancer?
Well, cancer is in general a very difficult to treat disease, and small cell lung cancer may be one of the most difficult to treat disease. So it's important to assemble a team of different specialists of multiple disciplines under your care that are able to guide you from different aspects that evaluate the individual contribution of disease impact, medical oncologists, radiation oncologists, also surgeons, pathologists, pulmonologists, and others that may be very influential in the treatment decision making. There are opportunities to ask questions, to learn about the disease, but also to help tailor a treatment plan that really fits your individual situation and your preferences as well. So I cannot overstate the importance of multidisciplinary care. It is a team effort that leads to the best outcomes in cancer care.
I agree with you. It does take a team effort. What are the current challenges in treating LS-SCLC effectively?
Well, I think there are two kinds. I mean, we have the standard treatments of chemotherapy and radiation, and they carry their individual side effects. The main problem is the disease. We see a disease that is very resistant to treatment, that has a very high probability of recurrence and spread into compartments that are particularly susceptible, like the brain, where it can wreak havoc even with relatively small disease volume, can cause seizures, bleeding, and other complications. The other one is the treatment itself. We do see obviously a very nice benefit of the new immunotherapies and treatment. We see an increase in survival in average by about 2 years. We see more patients, a higher percentage of patients having long-term durable disease control or remission. What we have to be concerned about are the side effects also. Every drug has them, but they come with a very unique flavor. If you activate the immune system can turn against even healthy parts of the body, and these autoimmune manifestations of therapy can be quite significant. They need to be recognized early and intervened on immediately for the best possible outcomes. So patients need to be aware, they need to be educated by their physician, but also in conjunction with their own self-education efforts. I believe online resources are very helpful. We have a drug website for durvalumab or Imfinzi called imfinzi.com. This is a very good starting point to get FDA-reviewed content that has an objective view of the data that is beneficial, as well as the side effects that are occurring with the drug.
The patient shouldn't be lazy. There's got to be some self-education there, right?
Oh, absolutely.
Now, doctor, I understand there's been some recent advancements made in the treatment of this disease. What can you share?
Yes, so I'm very excited. In partnership with AstraZeneca, we were able to develop the drug in clinical trials, in the Adriatic trial. And what we compared with our typical standard of care of chemotherapy, plus radiation for limited stage small cell lung cancer against chemotherapy plus radiation in addition to immunotherapy. And what we've seen was quite remarkable, an enormous improvement in what we call overall survival. The average patient here lives 2 years or more longer, and we had more durable responses here for treatment. So this was a really a replacement of the previous standard of care to include immunotherapy with Imfinzi going forward. I think that's a very exciting time in small cell lung cancer where we haven't seen an improvement in 25 years since the last FDA approval. So we're very excited about that.
Now, what is the final takeaway and where can our viewers go for more information?
Well, I mean, the first one is, and I think that's a really positive message, is there's improvement in treatment opportunities and there's hope for our patients. We want to relay this home. We always love to see trials turn out positive. We always do our best efforts and due diligence to make sure that we design drugs and trials to benefit patients. Not all end up being successful, unfortunately. This one was very, very positive and help us get treatments. We are very grateful for our partners with AstraZeneca to make these resources available to study these new treatment opportunities for patients. The importance of getting information out is very critical. We want to have patients receive this benefit at the earliest possible time point. So open communication with providers here, very important. But the bottom line is things are moving in the right direction and hope is certainly on the horizon for patients with limited stage small cell lung cancer and improving outcomes.
It also sounds like there's two important things I'm taking away from it. Number one, self-education, and number two, working with your team.
Absolutely. Very, very critical components.
Been speaking with Dr. Martin Dietrich, a medical oncologist. Thank you so much for joining us on Morning Blend.
Thank you so much for having me.